Hello, everybody. Welcome to another episode of the Holistic Health Hour. I'm Dr. Kevin Connors, where we try to our best to answer questions that you might have. So, if you have questions, you could use the chat. You can chat in your questions right now, but if you want to have a better chance that your questions will be answered, send them in at holistichealthhour.com, holistichealthhour.com, where you'll see all our past Holistic Health Hours and very nicely tabbed for easy reference on different subject matters that you might be interested in. So, without further ado, let's jump right into some of the questions that got submitted. Dear Dr. Connors, I have a friend who's taking diatomaceous earth daily on a permanent basis against parasites and toxins and is recommending us to do the same. Would this be something you would recommend to be good and safe, or is there any drawbacks to taking this permanently? What I understand, diatomaceous earth is a binder, and I am wondering if you always want to take it without a break, or would it be better to switch different kinds of binders and also allow some time in between each round? Well, if you buy food grade diatomaceous earth, I don't think there's anything wrong with taking it. To take anything on a constant, regular basis like that, diatomaceous earth can be irritating to the gut. It's always recommended that you start at a very small amount, like a half a teaspoon, and you work your way up to 2 teaspoons. Some people are taking tablespoons of it. It can be irritating to the gut. I mean, what diatomaceous earth does to your vegetable garden is that slugs that are crawling across it, diatomaceous earth is little pieces of silica that can damage the cell walls, the outer lining walls of little worms and things like that, and it slices them open and kills them. Well, it seems to me that it could have equal damaging effects on the little teeny cells of your epithelial cells of your gut lining. Now, typically it's considered food grade is considered safe to use for humans. It can be good for parasites. It can be good for a cleanse, but to use it on a daily basis forever, I don't know. I think I would switch off. I don't know that it really acts as a binder. There's other binders that are better out there. I like binders that have a combination of different things in it. So I know people are, drawn to using something like diatomaceous earth because it's so inexpensive. But maybe they're fine. So I'm not saying that they shouldn't do it, but maybe think of making sure you're not hurting your gut at the same time. So I don't see a problem necessarily. I don't personally know of any patient that's ever told me that they've been taking diatomaceous earth for X amount of years or something like that. Typically, it's taken for a short period of time. So I have not seen any studies of long-term studies of use. I'm sure there isn't any. So I guess I don't really have a real good answer for you there. I apologize. Next question. If I already know that what food allergies I have, and I am mostly gluten, dairy, and sugar-free already, what type of diet do you recommend that a phase 2 or phase 3 Lyme person follow? So phase 2 Lyme is what I have termed people that have chronic Lyme, where the bacteria has not gone the bacteria has gone intracellular, but you haven't formed any self-antibodies. So you're not in an autoimmune phase. Phase 3 Lyme is my term for someone who has now formed self-antibodies because of their Lyme infection. Now, there's other reasons why you can develop an autoimmune disease, not just because of a bacterial infection of Borrelia or something. There's lots of different things that can trigger an autoimmune disease. That means that your immune system created self-antibodies. But what you have to look for with Lyme disease, or if you do have self-antibodies, you have to look for what are my triggers? So triggers can change over time. So let's say I'm dietary triggers are one thing, and they're a very common thing, maybe the most common thing. But if I'm already dairy free, I'm already gluten free, and I'm already sugar free, what else do I need to look for? Well, it still can be valuable to run a Cyrex 10 profile because you may have developed antibodies to things that are in gluten-free foods and you don't know it. You might not be noticing any inflammation in the gut, therefore you don't think that food is causing any issues, but it can be still causing inflammation in the gut, not causing symptoms there, but causing symptoms in the brain, therefore giving you symptoms with a lot what would be known as a Lyme flare. So if you think you're in phase 2 or phase 3 Lyme and you're not having any problems, your life is going well, and you're not experiencing a great deal of symptoms or anything, maybe there isn't anything you need to do. But if you are noticing flares, you're noticing symptoms, you need to dig a little bit deeper and see if food you got to look for what are called triggers. So anything can be a trigger that is setting off an immune response, that's setting off a flare. So that can be a food that isn't necessarily causing you any tummy issues. So I don't have any issues when I eat corn, so I know it's not it. Well, that's not necessarily true. You might not have any stomach issues when you eat corn, but it's causing inflammation in your brain, and that's causing your Lyme flare. So it's still valuable if you're having these flares, if you're having symptom patterns, to do a food sensitivity panel. There's other things that cause flares too. So if you're on the autoimmune course, you'll see that tons of different things can cause flares, not just dietary things. So looking for things that are what are termed triggers that can be triggering an immune response and triggering a worsening of your condition is what you really want to dig into and look for. Question from the chat. Are hysterectomies a yes or no? God put those parts in. Seems dangerous to remove them if nothing is cancerous there, right? Well, there's other reasons why a person would have their uterus removed and or their ovaries removed, and it's not just because of cancer. So if a person has a fibroid tumor, for instance, a very common non-cancerous condition, but fibroid tumors can lead to morbidities that are very uncomfortable, typically lead to anemias that are uncorrectable. And you have to have that fibroid removed. And at a certain point, getting the uterus removed may be a better choice. So there's other reasons. So just to do a hysterectomy, just because you're beyond childbearing age and I just want to get my parts removed, seems, yes, I would agree. It seems odd. Seems like, why would you go through a surgery that you don't need to go through? But if you're having issues, then that's another problem. Of course, in itself, it causes problems. So I'm not beyond childbearing age and I want to leave my ovaries. I just want to get my uterus removed. My doctor's trying to push me to do that. Okay, uterus takes up space in the lower pelvic area. People that get the uterus removed tend to end up with tipped bladders and end up with recurrent bladder infections. That's just a possible complication to that. So there's reasons why not to do it. Second comment come in: pelvic organ prolapse to make room. So if you're having prolapse issues and the doctor is thinking that the uterus is contributing to that, you got to weigh all those things out. So hard question to answer without knowing the details of the overall condition. But in general, yeah, there's reasons to remove an organ. There's reasons to remove your appendix. There's reasons to do a hysterectomy. And you got to, weigh out the positives and the negatives, how it's going to help the person's overall health. If you're already in, a situation where you're not going to necessarily quote unquote use that organ for reproductive purposes, then it's an easier decision. But you want to weigh everything out. Next question. A doctor recently shared a successful story whereby a seizure patient who was experiencing 30 seizures per day took folinic acid according to instructions in the bottle, and 2 weeks later was not having seizures at all. Is it best to start small if possible in case there's a reaction with seizure medication? How will we know if it's working after 2 weeks? What tests would we need to check if the possibility of seizures activity? Yeah, this is a question that I wish I could just answer. It's totally case dependent. Are you asking, should you try folinic acid with somebody who is currently having seizures? What are they, epileptic seizures? Are they having seizures because of post-concussive issues? Are they having seizures because of Lyme disease? Are you having grand mal seizures? Are you having petite seizures? Are you having absent seizures? There's just a plethora of questions that I have with a question like this that make it impossible to answer. Things like this really you need to do a case review with me, and we can discuss that if you really want my help with something like this. If you're interested in getting a case review, just go to connorsclinic.com. You can go to the tab that says schedule now, and you can schedule your own case review and complete the whole intake form, and we can discuss the full case. I apologize, but this is just not a question that's not really answerable. And if a person is having seizures, like anything else, you want to get to the reason why that you're having seizures and try to deal with that first. I've had patients that had Lyme disease that was causing inflammation in the brain, and were having multiple. I had one young gal who was having over 50 absent seizures a day. As we started dealing with the cause of the Lyme disease and the inflammation in the brain, she was down to 1 a day quite quickly. And it's just dealing with that cause. So you're always looking for cause, and without knowing that, then there's not like, okay, because this person did this supplement and got this result, can't I take that supplement and get the same result if I had similar symptoms? Well, you can have similar symptoms that are caused from completely different causes. So you want to dig to find out what that cause is. Back to the chat. What are the negatives to a hysterectomy? Well, it depends case by case. So if you're going to do a complete hysterectomy and have your ovaries removed too, then if you're postmenopausal already, one would argue you're not really using your ovaries. They're not really producing much estrogen and progesterone at that time. Well, that is partially true. Your ovaries still will produce some estrogen and progesterone. But if you're just recently menopausal, or if you're not menopausal yet, then you will basically put yourself into menopause by having your ovaries removed. Negatives to removing the uterus are less. There's less negatives as far as there's outlying type negatives like I mentioned. You could have issues with tipped bladders, and then pooling of urine in the bladder, and recurrent bladder infections. That's something that can be helped, though not completely corrected, by doing some different manipulation to the pelvis and manipulation to the bladder. If you find a good practitioner. Other than that, there's not horrible gross negatives to getting your uterus removed. So we've had clients that have had uterine cancer that was contained in the uterus, but they did not want to have their uterus removed for whatever reasons. They were afraid of surgery and such. And every case is different. Many times we had to kind of talk people into getting over that fear, because many times if you can debulk a cancer. You can, in certain cancers, it can help tremendously. So there's not huge negatives. Some people would argue the same thing with, I've seen posts up there about appendix, the ways you could heal appendicitis naturally. I think that's just, it's kind of foolish. You deal with possible infection that could spread and kill a person. I just don't think we need to be so afraid of the medical care, even though there's lots of negatives to standards of care these days. We don't want to just clump everything into that negative bucket, even though many things deserve to be clumped into that bucket. But you have to use wisdom. That's what we're called to use. And if the circumstances of the case prevail to push us through all the wisdom that we can, that would be the best mode of action, then we should take the best mode of action. And I think through prayer and through asking questions. So ask questions of people like me and other people that have had patients that have done hysterectomies. Really, we haven't seen issues with it. Of course, you're doing a complete hysterectomy, removing the organs, and you're not in menopause. You're going to put yourself in menopause. If that's the case, then you really want to support your adrenals, because your adrenals do make progesterone and estrogen to a lesser extent. And people that go through menopause, sail through menopause without too many menopausal symptoms are people that have really healthy adrenal glands. People that already have fatigue of their adrenal glands, they're the ones that go through menopause and have tons of hot flashes and tons of symptoms because of that drop in rebound of estrogen and progesterone that's sudden when the ovaries start to shut down. People with really healthy adrenal glands don't really notice that because their adrenals are making up for it. So, there's positives and negatives to any surgery too. So, I don't want to make it sound like it's easy, but if you've discussed it with multiple different surgeons, you've discussed it with other doctors, and you're doing some studying on it, looking up positives and negatives on the internet, don't be scared of it, and then you're taking it to prayer and you're deciding what's the best course of action for my case. Next question: can you help with osteoarthritis pain in hands and back? So osteoarthritis, there's two different types of arthritides. There's degenerative arthritis and there's inflammatory arthritis. Not to say that degenerative arthritis can't be inflammatory, but it is to say that those two classifications of arthritis exist. And typically the inflammatory arthritides tend to be autoimmune, like rheumatoid, psoriatic arthritis, and gouty arthritis fall into the inflammatory arthritide category. Degenerative arthritis or osteoarthritis or degenerative joint disease or degenerative disc disease all are in the degenerative arthritis category. So degenerative arthritis and osteoarthritis, all of those are all the same nomenclature. So degenerative arthritis has to do with like wear and tear of a joint. So degenerative arthritis would be common in, I hurt my knee when I, played football in high school. And now at 40 years old, my knee has been acting up, and it gets swollen at different times if I aggravate it. Or, I hurt my hands, doing physical work my whole life and whatever job I did, and now I get inflammation in my fingers and joints. The difference in diagnosis has to do with looking at whether you have antibodies. So if a person has rheumatoid antibodies, they would fall into the inflammatory arthritis category, and you'd treat that very different than you would a degenerative arthritis or osteoarthritis. So if it's osteoarthritis, you'll see on X-ray, it will look differently too. You'll have, it will just look different on a plain film X-ray. It'll look different on a CT scan and MRI as well. So what do you do with degenerative joint disease, degenerative arthritis that's causing pain? Well, it still is inflammatory in the sense that every time you aggravate it, you have inflammation there, and that's really what's causing the pain. So you could use anti-inflammatories like flavonoids, so like curcumin, boswellia, um, stinging nettle, resveratrol, green tea extract. Those kinds of things would be good for the inflammation. The other thing that's good if it's a degenerative joint disease or osteoarthritis is chondroitin and glucosamine. So especially if it's a larger joint like your knee, even your fingers help with that, and certainly shoulders or your hip joint, because your joints are two bones that come together and then they're surrounded by a joint capsule, and in that joint capsule is a fluid. And that joint fluid is produced by the joint capsule cells, and glucosamine and chondroitin help stimulate production of that joint fluid. So the more fluid you have in there, the more cushion you have of the joint, the less irritation it's going to be. So glucosamine and chondroitin, typically they're a sulfite, can be beneficial taken for those. And using topical anti-inflammatories can be helpful. Using ice can be helpful. Using arnica can be helpful. Using CBD products can be helpful. So all those things can be helpful. If it is osteoarthritis, being careful of function, how you're using it. Maybe you're walking incorrectly. If it's a knee problem, getting some support, some orthotic support for your feet can be helpful. Going to a chiropractor can be helpful. Getting physical therapy can be helpful. All those things can be helpful for osteoarthritis. If it is an inflammatory arthritis, and if it is an autoimmune condition connected to it, now that's a whole different ball of wax that we're talking about. Still, you can be helped with the flavonoids and the anti-inflammatory things, but you need to dig in to find out what the triggers are. If it's rheumatoid arthritis, typically foods that are considered in the category of lectins, that is like potatoes and peppers and tomatoes, in that category, tend to, in general, cause more inflammation with rheumatoid arthritis patients. But there can be other food issues that can cause inflammation. So you have to really, if you think there's an autoimmune connection, you got to dig into the triggers for that, like I talked about in that other question. Going and joining our autoimmune course would be highly recommended. It's super cheap right now. So go to connorsclinic.com and you can click on the courses, the autoimmune, chronic disease and autoimmune course, if you have any suspicion that it is like a rheumatoid or something like that. Okay, hi, Dr. Connors. My husband has had 2 stents put in his heart 3 months ago, is still experiencing some issues when physically exerting himself, such as walking uphill or running. He's had burping starting, chest pain, left arm hurting. His cardio doctor doesn't feel it's heart related, as he also does have digestive disorders, but my husband is still concerned, mainly feeling that it could be the heart. Any thoughts? Well, of course, it could be the heart. So what do you do to find out if it's a heart? Well, getting some standard blood testing would be helpful. And getting a good cardiolipid panel would be helpful. Certainly. So understand that the same nerves that go to the heart that could give you these symptoms, your doctor is correct that digestive issues, especially stomach-related digestive issues, the upper GI issues, because they follow the same neurological pathway, can give you the exact same symptoms. Matter of fact, people with indigestion, people with hiatal hernia issues can get what has been termed a pseudocoronaries, because they can actually feel like an elephant standing on their chest. They feel like they're having a heart attack. They go in, they run a LDH, that's negative. They run some other blood panels that show possibility of acute myocardial infarction. They're all negative. They do an EKG and it's all normal. and then they, everything is passed, and they, they call it a pseudocoronary, and they suggest you go to a GI doctor, which typically does you very little good, because they'll put you on something even more horrific, called Prilosec, which is a PBI that blocks all your stomach acid. The problem really is a deficiency in stomach acid. So highly suggest you go to our website, connorsclinic.com, and search in the blog. So we have well over 1,000 blog posts, many of them tied to different videos explaining the condition in, ad nausea. And I think one thing that would help you is to go to our blog and search hypochlorhydria. Hypochlorhydria. If you just typing that, it will probably come up. We have a real nice search bar on our website. Hypochlorhydria means decrease in stomach acid. Chlorhydria stands for chloride. It's HCl is the stomach acid that these little cells in your stomach called parietal cells make. And when we eat, additives, colorings, flavorings, glyphosate, chemicals, we damage those cells and they don't produce enough HCl. And when we don't produce enough HCl, we don't get proper digestion of food. Food goes into the small intestine as a bolus that's only partially digested. It puts a whole lot of stress on our pancreas, increases the risk of pancreatic inflammation and or pancreatic cancers. It puts a lot of stress on our liver and our bile duct, our bile system, which secretes digestive enzymes for lipids, and it really stems from a decreased stomach acid. So hypochlorhydria will cause food to sit in your stomach longer than it should because it's not being digested. And the little stomach acids you have can regurgitate up into your esophagus. You can burp it up and you have acid, and then you think, oh, I have too much stomach acid. You go on a PPI or go take Tums or Rolaids or something like that. You're actually causing worse problems. And so I would agree with the doctor that you should, investigate that, first. I mean, you could know fairly quickly if you start taking HCl. If you go to that blog post, and I have a blog post on Helicobacter pylori, because having chronic HCl deficiency is going to set a person up for H. pylori infections. And so I have a blog post on that as well that you should probably read too. So it's kind of a simple fix in the sense of what you need to do is start taking HCl and digestive enzymes with your meals. However, if you already have an ulcer because of a decreased stomach acid, yes, you get an ulcer because of a decreased stomach acid, because a decreased stomach acid allows the continued growth of the opportunistic organism that's called Helicobacter pylori, and that's what causes a stomach ulcer. So that stomach ulcer will then be irritated by the HCl. So if you take HCl and it's like, oh my gosh, it really hurt my stomach, you need to back off and try to heal the stomach with deglycerized licorice or some other things to help heal your stomach lining. And then in a couple of weeks, go back on the HCl, or just try apple cider vinegar for a while, which is a little bit milder acid, and then get on the HCl. So there's a process. So I lay it out in that blog post. So I lay out the whole way to start that process and to take care of that problem in that blog post, and to deal with H. pylori as well. So yeah, you do want to get your heart checked. Yes, absolutely. But you do want to get your digestive system corrected, because you talk about coronary issues in H. pylori. H. pylori is one of the top 4 causes of coronary artery disease. So yes, H. pylori goes beyond the stomach, goes systemic, and causes inflammation and damage to the endothelial cells. Those are the cells that line the arteries. And it can get underneath the endothelial lining in the heart and damage the smooth muscle cells, damage the receptor sites, the ACE receptors, and other receptors, cause blood pressure issues, cause inflammation in the endothelial lining and cause heart disease. So dealing with it, so many things stem from digestion, stem from the stomach. So that's really where you need to start. So, if you have, I have a serious disease, I have cancer, well, you should still start healing the gut. I have serious disease, I have heart disease, well, you still should start healing the gut. Not that you don't deal with those other things, but you got to heal the gut as well. Okay, so again, go to connorsclinic.com, search hypochlorhydria, search Helicobacter pylori or H. pylori, and you'll find those blog posts that go into that, what I'm just saying, in detail, and I know they have some videos on them too. Okay, next question. What are your thoughts on very low dose, 3 milligrams of naltrexone for Lyme patients? So low dose naltrexone, or LDN as it's even termed now, is an off-label use of a drug that was approved years ago to help get people off of addictions. It's a drug called naltrexone. It was typically approved on, I think, 50 milligrams to get people off of addictive substances. But they found that low doses of naltrexone act as an immune regulator. So it upregulates Treg cells. So understand, your immune cells in your body, you have Th1 category and there's a couple different ways to classify an immune response. One is a Th1 versus a Th2 response. Th1 is an immediate immune response. It's an inflammatory response. It's how you kill pathogens. A Th2 response is a secondary response. It's a cell-mediated response. It's a B-cell response. It's how you make antibodies to tag pathogens so that the Th1 response can fire again and kill those pathogens. The problem is that with autoimmune diseases, we can have this constant upregulation of a Th1 response, and you get this damage to cell membranes, damage to cells that you have antibodies. So remember, anytime you have antibodies to yourself, let's say you have antibodies to a thyroid gland. So anytime you stimulate an immune response, anytime you have an uptick of that Th1 response, and if you have a chronic uptick of that Th1 response, usually because you're not dealing with a trigger, then you're going to be constantly killing your thyroid gland. You're going to be constantly destroying that which you have antibodies against. Anytime you have an upregulation of your immune system, whether you do it artificially because you are inadvertently and ignorantly taking immune stimulants. Say I have an autoimmune disease and I keep taking vitamin C and garlic because my doctor told me to take it because I have chronic Lyme, so I should be taking cat's claw and garlic and vitamin C. Well, what if you already have antibodies to self-tissue? Every time you're taking that substance, you're stimulating an immune response. And every time you stimulate an immune response, you're going to kill that which you have antibodies against. And if you have antibodies against your own body, you have antibodies against self-tissue, aka you have an autoimmune disease that has been undiagnosed, then you are going to cause more inflammation, more damage, more symptoms. And a lot of those people go, oh my gosh, I have a Lyme flare. You don't really have a Lyme flare. You are causing damage to your own cells. So stop taking those immune stimulants. Okay, maybe you're beyond that point and you've educated yourself and now you're knowledgeable in that. And boy, I haven't taken immune stimulants for a whole long time, but I keep getting these flares. My Lyme keeps flaring up. Well, you got to look for other triggers, like we talked about with other questions. You got to dig in to find, well, are there any foods that are triggers? Well, I'm already dairy-free and gluten-free, so what else could it be? It could be a ton of other things. It could be anything else. You need to test for that. There's other triggers too. Maybe it's the smell of gasoline. Maybe it's the smell of mold. Maybe it's the smell of perfume. Maybe it's things that there's just a zillion things that could be triggers. You're going to have to put on your Sherlock Holmes hat and figure this out. Because nobody can completely, you can't test for all these things. You got to try to figure out what are your triggers. Now, there are some things that are what are called Treg stimulators. So remember I said there's a Th1 response and a Th2 response, and people that have constant autoimmune flares are stuck in a Th1 dominant situation, maybe by their own making, like I said. But there are some things, some nutritional things and some off-label medication that can stimulate Treg cells. Treg cells can help calm down a Th1 response and calm down a Th2 response. They help balance that. So Treg stimulators can be good to take. Vitamin D is actually a Treg stimulator. It's not an immune stimulator. And what this person asked, LDN, low dose naltrexone, has been found to be a Treg stimulator. So that's why it's been found to be helpful for autoimmune conditions, because it helps calm down that Th1 response. So yes, so it could be helpful. Typically, people start by taking 1.5 milligrams, go up to 3 milligrams, and then go up to 4.5 milligrams. And that's considered, depends on the person's weight too, but that's considered low dose naltrexone, and it could be very beneficial for autoimmune patients. Next question. What is the best natural treatment for multiple sclerosis? Well, understand multiple sclerosis can have multiple causes. So multiple sclerosis is a demyelinating disease, meaning that something is destroying the myelin sheath. So the myelin sheath is the sheath that in your neurons in your brain. So you have neurons in your brain that are covered in myelin, and it causes the connection, the communication along that neuron to be sped up tremendously. So when we have a disorder that breaks down that myelin, then we could have issues with that nerve's communication. It's not going to function as well, and then you end up with issues. So if you have a demyelinated disease that's demyelinating motor neurons that are going to your arm, you could have issues with arm function. You could have, all sorts of problems. So depending on where that demyelination is where you're going to have problems. Multiple sclerosis is plaquing of the myelin sheath and breakdown of that myelin sheath. So what you'll see with multiple sclerosis, if you did an neural antibody test, you'll typically have antibodies against myelin sheath cells. So you'll have antibodies against myelin. So you'll have destruction of myelin. So it's an autoimmune disorder. Now, again, what was the cause of that? It could be a myriad of different causes. A person can end up with myelin sheath and myelin antibodies post-concussion. They had a concussion 10 years ago playing hockey, ski accident, car accident 15 years ago. And now they're having upper motor neuron symptoms, meaning they're having issues with motion. They're having function of muscles, motor neurons. They're having issues with sensory issues. And then you do an MRI, and you have plaquing of your myelin sheath cells. You have demyelination going on, and you have multiple sclerosis. Okay, well, again, that doesn't help at all, and all they do is give you a drug that is mildly beneficial for some people. You have to dig into cause. You have to dig into everything that you would dig into with an autoimmune disease. So you test for neuronal antibodies. You'll definitely see if you have plaquing of the myelin in multiple sclerosis, you're going to definitely see myelin antibodies, possibly other antibodies. You look at the cross-reactants to those. Cross-reactants to myelin is gluten, so you got to go off of some things immediately. Go on a gluten-free diet. Also want to test for other triggers. You want to do a Cyrex array 10 at least, where you're looking for other food triggers and you're trying to calm down the immune system. Definitely go off of any immune stimulant supplements that you're taking, anything else you're doing to stimulate the immune system, because again, every time you stimulate the immune system, when you have self-antibodies, you're going to create further destruction. So why do some people have multiple sclerosis that can manage it quite well and they don't seem to have a lot of progression? Because they're doing these things. Other people, they're multiple sclerosis progresses quite quickly because they're not doing these things. With any autoimmune disease, you can't necessarily cure it, but you can manage it if you find your triggers. They take time. So, don't beat yourself up, but you find your triggers and you remove those triggers and you calm down the whole response. Definitely with any neuronal antibodies, and that's with multiple sclerosis, with myelin antibodies would fall into that, has to be no alcohol as well. They found with studies that alcohol increases the inflammation. The brain is going to increase the damage on and destruction of the myelin sheath cells. So natural treatment for multiple sclerosis it's really an autoimmune disorder. So you're going down that whole autoimmune pathway, looking for triggers, looking for things that stimulate the immune system, and you're going to calm those down. You're going to change your diet, change your nutritional protocol, make sure you're not taking any immune stimulants, and you go down that pathway to discover any new triggers that you have. And once you calm that down, you can decrease progression. And really, that's really the treatment. I don't want to simplify it because it isn't simple, because you're digging and you have to run some tests to find out what these are, and you have to be diligent about looking for triggers and trying to remove those from your diet. So it's not easy. I'm not saying it's easy, but this is how you're going to save your life. It's not something you should take lightly, because an autoimmune disease has multiple different phases. So the more destruction you have destruction of myelin sheath cells. I mean, they're gone. So it's not good when that happens. So the oligodendrocytes are not going to grow back. So you have to stop that progression in its tracks as fast as possible. Okay, next question. Is the Beamer a good PEMF unit? So the Beamer is a low Gauss PEMF. So PEMF units are measured in the Gauss output of electricity. There's low Gauss output PEMFs on the market. Two that are popular is the IMRS and the Beamer brands. Are they good units? If you have them, use them. Unfortunately, all the research on PEMF, there's a plethora of research for PEMF on how PEMF, which is pulsed electromagnetic field therapy, it's an electrical pulse. PEMF therapy can be extremely beneficial to improve cell membrane potential, increase the cell charge, increase a person's health in so many ways. It can be very beneficial. Can decrease inflammations. You talk about, things that will help osteoarthritis or degenerative arthritis or even inflammatory arthritis. PEMF is great for that. However, all the research on PEMF was done with high Gauss PEMF units. Let me give you an example. So the Beamer and the IMRS function under 1,000 Gauss. I think they're like 700 Gauss. Professional PEMF is between 25 and 30,000 Gauss. That's a big difference. 25,000 Gauss versus 700 Gauss. That's a big difference. So you can't really, I know those companies steal that data in a sense and say, see, we're a PEMF machine and look at all this wonderful data, how it does all this wonderful stuff. Well, it's not really a real fair comparison, because that was tested with a 25 to 30,000 Gauss machine, all those studies, not on a machine that puts out 700 Gauss. Now, I'm not saying that these low Gauss PEMFs don't have benefit. I think they all have benefit. I just don't know that they have the same benefit as a good, quality PEMF. The problem is that their good quality PEMF machine is super expensive. Like, we have a PEMF in our office. It's 30,000 Gauss PEMF, but they're also $38,000. Well, who's going to buy that for their house? Nobody. But you can buy a good, or a Beamer might cost you $7,000, $8,000, $9,000. For $9,000, you can buy a 7,000 Gauss PEMF, which a lot of clinics have. You might go to a chiropractor or a physical therapist that uses a PEMF, and it's a 7,000 Gauss PEMF. It's a much better quality PEMF than a 700 Gauss PEMF. So is it a good PEMF unit? Yeah, if you haven't used it, it's better than nothing. Would I spend $7,000, $5,000, $3,000 on one of those? No, I wouldn't. If I was going to spend, if I had a limited budget, if I could afford a $9,000, 7,000 Gauss PEMF, I would choose that. Or I'd save up to get that, honestly. So yeah, I don't want to knock a company. I just think they oversell, and they're not really using correct data. I don't like that when companies, it's not incorrect, but it's not really data that's based upon the Gauss output of your machine. So it's like a laser company. There's different levels of laser, class 1, 2, 3, 4 of laser. Well, all the research on laser is done with a class 4 laser, and then a company that's selling a class 2 laser is pilfering that data and saying, look at what laser does. Well, yeah, you're still a laser company. You still sell a laser, but it's not going to do the exact same thing as a class 4 laser. It's just not really fair. But still, class 2 laser is better than no laser, I guess. So, okay, we have time for one more question. Is it possible for a person to take too many supplements? Is it possible for a person to take too many supplements? Yes, it is. So for sure it is. It's even more probable that a person's taking incorrect supplements. So I mean, I think I have a blog post on minerals that I did a number of years ago. It's worth looking at it. That's what we see a lot. And I think it's good to evaluate your supplements. A lot of people will be taking like a multiple mineral or a multiple vitamin, and it's got things in it that nobody should be consuming. Here's an example. I just had a chat with somebody this morning that was put on folic acid. Well, folic acid is synthetic folate, understand. So it was named folic acid when they synthesized it back in, I think, the 1950s, when they discovered folate. Remember, folate is the B vitamin that's found in foliage, hence the name. So in green leafy vegetables, folate is found. They found that folate deficiencies caused neural tube defects when women were pregnant, with babies, and they had folate deficiency. So they synthesized folate in the laboratory, called it folic acid. So folic acid, when you look at a label and says folic acid, then it's synthetic folate. Some companies will still say folic acid as methyl tetrahydrofolate, then it's the right form of folate, or folic acid as calcium folinate, then it's the right folic acid. However, there's still a lot of companies out there that really don't care about what they put in their supplements. They only care about selling supplements. So, so more than taking too many supplements, which that can be a problem, I see people taking incorrect things, or poor quality supplements, poor quality minerals, elemental minerals. Oh boy, that's like just poison for your body. I have blog posts on that as well. So look that up, correct type of minerals, how it should be taken, the way you'd eat it in nature, double bonded to an amino acid, how you'd eat it in a vegetable or in a good quality grass-fed beef, how you'd get it in that, not how you'd get it from the ground. We don't eat dirt to get our minerals. And then taking supplements. You talk about too many supplements. Taking supplements incorrectly based upon your condition. You see, cancer patients taking copper. No, cancer patients do not take copper. Copper is a growth support. It will stimulate cell growth, cell replication. Cancer patients should not take a lot of methyl groups for reasons that methyl groups can silence tumor suppressor genes, and you need healthy function of your tumor suppressor genes if you're going to stimulate intrinsic apoptosis of cancer cells. Cancer patients shouldn't be taking antioxidants. If you're trying to kill cancer, if you already know you have cancer, you should change there's things that you should do if you don't have cancer. There's totally different things you should do if you were diagnosed with cancer. There's things that you should do if you have a heart disease, and totally different things that you should do if you have cancer. If you have cancer, you should not be taking nitric oxide. If you have heart disease but not cancer, nitric oxide can be extremely beneficial. If you're trying to prevent cancer, antioxidants are a very wise thing to be taking. But if you already have cancer, you shouldn't be taking antioxidants, because you want to create a pro-oxidative stress to a cancer cell in order to kill it. So it really depends on your condition. You should have communication with a practitioner who knows these things. And unfortunately, I talk to a lot of people that come from practitioners that have a serious disease, and they're on things that they should not be taking, that could actually be promoting their cancer. And that's not a wise thing. So you got to talk to somebody who knows what they're doing per that condition, because it is very different. I just wish it was just real simple, but it's not. It's just not that simple. So last question came in on the blog. Is there harm in long-term use of apple cider vinegar? I add 1 tablespoon-ish to my tea, 20 ounces of water. No, so apple cider vinegar is acetic acid. So it's a milder acid than HCl. So what would be the purpose of taking apple cider vinegar? The purpose is to help acidify your stomach. Can you take it on an empty stomach? Yeah, you can. Would it be maybe even better for you if you take it with your meal or before a meal? It will help you break down the meal and help you digest your food. So yes, but you can take it on an empty stomach too. There is zero harm in long-term use of taking apple cider vinegar. No, it's good for you, and it's just go back to my blog, connorsclinic.com, look at hypochlorhydria, and you'll find that the #1 cause of ill health worldwide is hypochlorhydria, which leads to all sorts of problems downstream, years and years later, even cancer. So anything you can do to help acidify your stomach, better off you could do. Opposite of that would be foolish things like I'm taking, high pH water. Wrong. That's just the wrong thing. I'm taking baking soda because I want to kill cancer in my breast. Wrong. It just doesn't work that way. All you're doing is alkalizing your stomach and causing more comorbidities. You're certainly not alkalizing the cancer by taking baking soda in your stomach, unless you actually had stomach cancer. So, and stomach cancer is most commonly caused from H. pylori, which is caused from hypochlorhydria. So, yeah, so we can make mistakes. There's a lot of ill information, just completely wrong information out there, and even practitioners that don't understand all conditions, and want to sell you stuff and supplements. So yeah, you could take too many things. I've had people come to me and they're taking 100 different supplements. It's like, oh my gosh. So yeah, yes, you can take too many supplements. Yes, you could be taking the wrong thing. And that can be, too much of a good thing can be a bad thing, is my saying. So hopefully that helps. Go to Holistic Health Hour if you want to submit questions beforehand so you can get them on. You can also see all our past Holistic Health Hours really nicely indexed by topic as well. And go to connorsclinic.com. If you want to make an appointment with me, you can through self-schedule right there. If you want to just talk to us, you can call us too. But certainly look at our blogs, look at our courses. They're pretty darn cheap. And our blogs are pretty darn cheap too because they're free. So go to our blogs. We have a nice index and search on our site as well. All right. God bless. Thanks for being with us. And we will not see you next week. We will not have a Holistic Health Hour next week. I'll be gone, but the week after. Bye-bye.